Many older adults are surprised to learn that poor circulation often begins years before it causes severe pain or disability. Long before peripheral artery disease is diagnosed, your body may already be sending subtle warning signs that blood isn't flowing as well as it should. Because these changes usually develop gradually, they're often mistaken for normal aging, arthritis, or simply being out of shape. Feeling an unusual ache in your legs after a short walk, noticing that one foot always seems colder than the other, or finding that small cuts on your feet take longer to heal may not seem related. Yet these seemingly minor changes can sometimes be early signs that your arteries are becoming narrowed, reducing the amount of oxygen-rich blood reaching your muscles and tissues. Peripheral artery disease, commonly known as PAD, occurs when fatty deposits build up inside the arteries, making it harder for blood to reach the legs and feet. It becomes much more common after the age of 70 and is more than just a circulation problem. PAD can also be an important warning that the arteries supplying your heart and brain may be affected, increasing the risk of heart attack and stroke. The challenge is recognizing these early warning signs before they begin to limit your mobility, independence, and quality of life. Your body often provides gentle clues long before the condition becomes severe. And understanding those clues can help you know when it's time to seek medical advice. In today's video, we'll explore 9 early signs of peripheral artery disease that seniors should never ignore. These symptoms don't automatically mean you have PAD, as other health conditions can cause similar problems. However, if several of these signs occur together or continue over time, they deserve prompt medical attention. Early diagnosis and treatment can help improve blood flow, relieve symptoms, and reduce the risk of serious complications. Before we continue, we'd love to know a little about you. Tell us your age and the country you're watching from in the comments below. It's always a pleasure to see members of our Ageless Wellness TV family joining us from different parts of the world. If you enjoy reliable health information created especially for older adults, please like this video, subscribe to the channel, and turn on notifications so you never miss our future videos. Now, let's look at the first early sign of peripheral artery disease after 70, one that many older adults dismiss as nothing more than tired muscles or slowing down with age. Sign number 1. Leg pain or cramping while walking. The first early sign is pain, cramping, or a heavy, tired feeling in your legs that appears when you walk and disappears after you stop to rest. First, the discomfort may be so mild that it's easy to ignore. You might notice it only after walking a few hundred meters, climbing a flight of stairs, or keeping pace with someone else, because the pain goes away after a few minutes of resting. Many older adults assume it's simply a sign of aging or muscles becoming weaker. In reality, this pattern can be one of the earliest signs of peripheral artery disease. When you walk, your leg muscles need more oxygen-rich blood to keep moving. If the arteries have become narrowed by fatty deposits, they can't deliver enough blood to meet that demand. As a result, the muscles begin to ache or cramp until you stop and rest. Doctors call this symptom intermittent claudication, and it's one of the most common early signs of PAD. The discomfort is most often felt in the calves, but it can also occur in the thighs, hips, or buttocks, depending on which arteries are affected. Some people gradually adjust their lives without even realizing it. They begin avoiding long walks, choosing lifts instead of stairs, or taking frequent breaks while shopping. These changes may seem minor, but they can signal that circulation is becoming increasingly restricted. While leg pain can have many different causes, pain that repeatedly appears during activity and improves with rest should never be ignored, especially after the age of 70. It's worth discussing with your healthcare provider, as early treatment may help improve blood flow and reduce the risk of more serious complications. Coming up next is another early warning sign that often seems harmless at first, but may reveal that your circulation isn't keeping your feet as healthy as it should. Sign number 2. one foot or leg feels colder than the other. The second early sign is noticing that one foot or lower leg consistently feels colder than the other. Many older adults don't pay much attention to this at first. They may simply put on an extra pair of socks or assume the room is cold. But if one foot regularly feels cooler than the other, even when both have been exposed to the same temperature, it could be a sign that blood isn't reaching that leg as effectively as it should. Your blood carries warmth as well as oxygen and nutrients to every part of your body. When an artery becomes narrowed, less warm blood reaches the tissues beyond the blockage. As a result, the affected foot or leg may feel noticeably cooler to the touch. You might also notice that the colder foot takes longer to warm up after being outside, or that it remains cool even while you're resting under a blanket. Sometimes a family member notices the difference before you do. Although a cold foot doesn't always mean you have peripheral artery disease, it should never be ignored if it happens repeatedly or is accompanied by other symptoms, such as leg pain while walking, numbness, or slow-healing wounds. That a simple examination by your healthcare provider can often determine whether poor circulation is contributing to the problem. Detecting PAD early gives you the best opportunity to slow its progression and protect your overall health. Next, we'll discuss another warning sign that often appears on the skin and feet, one that many people mistake for an ordinary part of getting older, even though it can be an important clue that blood flow has been reduced. Sign number 3. Slow healing cuts or sores on your feet or toes. The third early sign is noticing that small cuts, blisters, or sores on your feet or toes take much longer to heal than they used to. A minor scrape from a new pair of shoes or a small nick while trimming your toenails should normally begin healing within a few days. But when blood flow is reduced, your body's natural healing process slows down because the injured tissue isn't receiving enough oxygen and nutrients to repair itself. At first, you may not think much of it. You might cover the sore with a bandage and expect it to improve. Days turn into weeks, yet the wound changes very little or seems to heal only partially before breaking open again. Some sores may become painful, while others remain surprisingly painless, especially if nerve damage is also present. This is one reason it's so important to inspect your feet regularly, even if you don't feel any discomfort. Poorly healing wounds are more than an inconvenience. They increase the risk of infection, and in advanced cases of peripheral artery disease, they can become serious enough to require specialized treatment. That's why healthcare providers take any persistent foot sore very seriously, particularly in older adults. If you notice a wound on your foot or toes that isn't improving, don't wait for it to become worse. Arrange a medical evaluation as soon as possible. Early treatment can help restore circulation, promote healing, and prevent complications. Next, we'll look at another subtle warning sign that often appears gradually. A change in the color of your feet or toes that can reveal your circulation is under strain. Sign number 4. Changes in the color of your feet or toes. The fourth early sign is a noticeable change in the color of your feet or toes. Healthy circulation gives your skin a natural, even color because oxygen-rich blood is constantly reaching the tissues. But when blood flow becomes restricted, the skin may begin to look pale, bluish, purplish, or even unusually red under certain conditions. You may first notice these changes after sitting for a while or when you raise your legs. Some people find that their feet become pale when elevated but turn deep red or purplish when they stand up. Others notice that one foot looks different from the other, even though there hasn't been an injury. These color changes happen because your blood vessels are struggling to deliver enough oxygen-rich blood to the affected area. As peripheral artery disease progresses, the skin may also appear thinner, shinier, or more fragile than before. It's easy to blame these changes on aging or poor lighting, especially if they come and go. However, when skin color changes are persistent or occur alongside leg pain, cold feet, or slow-healing wounds, they should never be ignored. Checking your feet regularly can help you notice changes early. If you see a persistent difference in color, particularly if it's affecting only one foot or is accompanied by pain or sores, arrange an appointment with your healthcare provider. Early evaluation can help identify circulation problems before they become more serious. Coming up next is another warning sign that many older adults don't connect with poor circulation: a gradual loss of hair and other changes in the skin that can reveal your arteries are no longer supplying enough blood to your legs. Sign number 5. Hair loss on the legs and thickened, slow-growing toenails. The fifth early sign is a gradual loss of hair on your lower legs, along with toenails that become thicker, brittle, or grow much more slowly than they used to. Most people don't think of these changes as a circulation problem. It's easy to assume they're simply part of getting older. However, healthy hair follicles and nails depend on a steady supply of oxygen and nutrients carried by the blood. When circulation is reduced, these tissues are often among the first to be affected. You may notice that the hair on one or both lower legs has become much thinner or disappeared altogether. At the same time, your toenails may become thick, dull, or difficult to trim. Some people also find that their nails seem to stop growing as quickly as they once did. These changes usually develop slowly, which is why they're so often overlooked. They rarely cause pain, but they can be an important clue that your legs and feet aren't receiving enough blood to stay healthy. Of course, hair loss and nail changes can occur for many reasons, including aging, certain skin conditions, or fungal nail infections. But when they appear alongside other signs we've discussed, such as leg pain while walking, cold feet, or slow healing sores, they deserve a closer look. Paying attention to these subtle changes can make a real difference. The earlier peripheral artery disease is identified, the more treatment options are available to improve blood flow and help prevent serious complications. Next, we'll discuss another warning sign that can make even short walks feel increasingly difficult, a symptom that many older adults mistake for simple fatigue, when it may actually be a sign that their muscles aren't getting the oxygen they need. Sign number 6. Numbness or weakness in the legs or feet. The sixth early sign is a persistent feeling of numbness, tingling, or weakness in your legs or feet. Many older adults describe it as feeling as though their foot has fallen asleep, even though they haven't been sitting in one position for very long. Others notice that one leg feels weaker than the other or that their foot doesn't seem as steady when walking. These symptoms can occur because the nerves and muscles depend on a constant supply of oxygen-rich blood to function properly. When circulation is reduced, they may not receive the nourishment they need, leading to unusual sensations or a gradual loss of strength. At first, the changes may be subtle. You might find yourself stumbling more often, feeling less confident on uneven ground, or needing to hold on to a handrail when climbing stairs. Some people begin avoiding longer walks because their legs simply don't feel as strong as they once did. Of course, numbness and weakness can have many different causes, including nerve disorders, spinal problems, or vitamin deficiencies. However, when these symptoms occur together with leg pain while walking, cold feet, skin color changes, or slow healing sores, peripheral artery disease becomes an important possibility that should be evaluated. Don't ignore persistent numbness or weakness, especially if it affects only one leg or continues to worsen over time. A medical assessment can help identify the cause and determine whether poor circulation is contributing to the problem. Next, we'll look at another warning sign that often appears only after the condition has progressed, a pain that continues even while you're resting or trying to sleep, signaling that your circulation may have become severely reduced. This happens because, as peripheral artery disease becomes more severe, even resting muscles and tissues may not receive enough oxygen-rich blood. Lying flat can further reduce blood flow to the feet, making the pain feel more intense. Some people discover that hanging one leg over the side of the bed or getting up to walk around for a few minutes provides temporary relief. While this may ease the discomfort, it doesn't solve the underlying problem. It can actually be an important clue that your circulation has become significantly impaired. Pain at rest is not a symptom to ignore. It may indicate that peripheral artery disease has progressed and that the tissues in your feet are no longer receiving the blood supply they need to stay healthy. Without treatment, the risk of non-healing wounds, infection, and tissue damage increases that if you regularly experience foot or toe pain while resting, especially if it's accompanied by other signs we've discussed, seek medical attention promptly. Early treatment can help restore blood flow and reduce the risk of serious complications. Next, we'll discuss another warning sign that can appear right before your eyes: a weak or absent pulse in your feet, something your healthcare provider often checks during a routine examination because it can reveal reduced circulation long before more serious problems develop. Sign number 8. A weak or absent pulse in your feet. The eighth early sign is a pulse in your feet that feels weaker than normal or can't be felt at all. Most people don't routinely check the pulse in their feet, and that's perfectly understandable. In fact, many only learn about this sign during a medical examination. Healthcare providers often feel for the pulse on the top of the foot and behind the ankle because it gives valuable information about how well blood is flowing to the lower legs. When the arteries become narrowed by plaque, less blood reaches the feet. As a result, the pulse may become faint or disappear altogether. This doesn't always cause noticeable symptoms at first, which is why routine checkups become increasingly important as we age. A weak pulse is often accompanied by other signs we've already discussed, such as pain while walking, cold feet, slow healing sores, or changes in skin color. Looking at these symptoms together gives a much clearer picture of what's happening with your circulation. If your healthcare provider tells you that the pulse in one or both feet is difficult to detect, don't panic. It doesn't automatically mean you have severe peripheral artery disease. However, it does mean further evaluation may be needed. Simple, painless tests can measure blood flow in your legs and help determine whether treatment is necessary. Recognizing this sign early gives you the opportunity to take action before more serious complications develop. With appropriate treatment and healthy lifestyle changes, many people are able to improve their circulation and continue living active, independent lives. Sign number 9. Shiny skin and thickened, brittle toenails. The ninth and final early sign is skin on your lower legs or feet that becomes unusually shiny, smooth, or thin, along with toenails that are thick, brittle, or growing much more slowly than before. These changes often happen so gradually that they're easy to overlook. Many older adults simply assume they're another part of getting older. However, your skin and nails rely on a healthy blood supply to receive the oxygen and nutrients they need. When circulation is reduced over time, they begin to show visible signs of poor nourishment. You may notice that the skin on your legs looks tight or glossy, almost as if it has been polished. It may also become delicate and tear more easily after a minor bump or scratch. At the same time, your toenails may become thick, brittle, discolored, or grow much more slowly than they once did. Although these changes can have other causes, they become much more significant when they occur alongside symptoms such as leg pain while walking, cold feet, slow healing wounds, or changes in skin color. Together, they may indicate that peripheral artery disease is affecting the health of your legs and feet. The good news is that PAD can often be managed successfully when it's identified early. Your healthcare provider may recommend lifestyle changes, such as regular supervised walking, stopping smoking if you smoke, eating a heart-healthy diet, and controlling conditions like diabetes, high blood pressure, and high cholesterol. In some cases, medication or procedures to improve blood flow may also be recommended. Remember, the symptoms we've discussed today do not automatically mean you have peripheral artery disease, but they should never be ignored. Paying attention to these early warning signs and seeking medical advice promptly can help protect not only your legs, but also your heart and brain. If you found this video helpful, please give it a thumbs up, subscribe to Ageless Wellness TV, and share it with a friend or family member who may benefit from this information. Thank you for watching. Take good care of yourself, and we'll see you again in the next video.